When we say personalized treatment, we refer to adapting the treatment to the season, the location, and the individual. Adhering to the principle of adapting treatment to the characteristics of different seasons involves considering the climatic features when determining the therapeutic approach. For instance, during the spring and summer seasons when the weather gradually warms and the yang qi is ascending, the body's pores become more relaxed and open. Even if there is an external invasion of wind cold, one should be cautious in using strong diaphoretic and dispersing herbs like ephedra and cinnamon to avoid excessive sweating that might deplete qi and yin. In contrast, during the autumn and winter seasons when the climate becomes colder and the yang qi wanes and the body's pores tighten, if there is a heat syndrome, one should also exercise caution in using cold herbs like gypsum and mint to prevent excessive coldness that may harm yang. Considering the geographical environment when determining the therapeutic approach is known as adapting to the location. For example, when treating an exterior wind-cold syndrome with herbs like ephedra and cinnamon, in extremely cold regions of the Northwest, the dosage can be slightly heavier, whereas in the warm and hot Southeast regions, the dosage should be lighter. Adapting the treatment to the patient's age, gender, constitution, lifestyle, and other individual characteristics is referred to as personalized treatment. In the case of elderly individuals, who often experience a decline in qi and blood, reduced physical activities, and are prone to deficiency syndromes, or a combination of deficiency and excess, the treatment approach should focus on tonifying deficiencies for those with deficiency syndromes. However, when dealing with a combination of deficiency and excess, especially when attacking pathogenic factors, careful consideration of herbal formulations is necessary to avoid compromising the body's vital energy. Children have vigorous vitality, but their qi and blood are relatively insufficient, and their organs are delicate. Additionally, infants and young children are unable to manage their own lives, often experiencing irregular feeding, imbalances in temperature, and susceptibility to illnesses. Therefore, when treating children, caution is advised against using strong purgatives and tonics. For women, factors such as menstrual cycles, pregnancy, and postpartum conditions must be taken into account when prescribing medications. During pregnancy, the use of drastic purgatives, blood-breaking herbs, slippery and dispersing herbs, as well as toxic substances, should be avoided or used cautiously to prevent harm to the fetus. Postpartum considerations include addressing deficiencies in qi and blood and monitoring lochia conditions. The treatment principles of adapting to the season, location, and individual needs demonstrate the holistic perspective and the flexibility of the differential diagnosis and treatment approach in traditional Chinese medicine. It emphasizes the importance of considering various factors and tailoring the treatment plan to the specific circumstances of each patient.